Molly, today, of course, competing studies on everything from the joblessness to small businesses. Let's talk to a couple of lawmakers from both sides of the aisle. Republican Illinois Congresswoman Judy Biggert and Democratic Kentucky Congressman John Yarmuth. Good to see you both. Representative Biggert, let me start with you. You may have seen the study by the President's Council of Economic Advisors. The President talking about it today. It shows that small businesses pay almost 20% more than big companies to provide workers with health insurance. Does health reform need to remedy that tremendous disparity, and don't the Democratic proposals do precisely that?
Well, yes, we do need to have a reform for small businesses, and for years been working on this, but we don't need a revolution. What we need is associated health plans so that small businesses can band together and get the same discounts and the same benefits that large companies like the federal government or Microsoft or any of those big companies.
Yeah, greater competition. I've never understood why there are borders as to where insurance companies can and cannot compete. Makes no sense. Congressman Yarmuth, Republicans, as you know, have their own study. This one's by the National Federation of Independent Businesses. That one determined that the Democrat-written proposals would destroy 1 million more jobs than the economy has already lost. My goodness. Can we really afford that at a time of rampant unemployment?
Well, I'll tell you, we had a hearing earlier this year in the Ways and Means Committee, and the representative of the NFIB was there sitting right next to a small business person who was urging us to pass this bill and basically said, you don't represent me. And we all know, you know, you can get groups to say anything you want. There's one report out, just came out this week, by the Economic Policy Institute that said our proposal, the House proposal, would save every small business $3,500 per employee. So there are numbers all over the place. I think what Judy said, and Judy's a great member. We've worked together on a number of things when I was on the Education Committee. What we all know that small businesses suffer. I was a small businessman. The rates are very unpredictable, and part of the problem is there isn't competition. Just letting them join in a group, particularly if they can compete across the nation. Well,
what isn't that the solution then?
Maybe it would do that.
Let them compete. I mean, both of you would agree, isn't it? Let the insurance companies compete across state lines.
Well, but I mean, that's a whole other issue. But what our plan does
it's a great issue. It's a great solution, isn't it?
Well, our plan does that. It sets up a competitive environment through the insurance exchanges, and it forces them to compete also, not just with each other, but with a public option, and which the vast majority of American people appreciate and want to do. So we do use competition.
Representative Biggert, you know, when the president argues that this very expensive health care bill is not going to add a single penny to the deficit, do your constituents believe that?
No. My constituents don't believe it, and they think that, again, the taxpayer is going to be hit. And it's been said that this plan is going to cost over $1 trillion, $1.6 trillion.
Right.
And what are we going to do? So even the CBO, the Congressional Budget Authority, came in and said this plan is going to increase cost. It is not going to make any dent in the cost. And that's one of the things that we all want. Is what everybody wants is a reform that is cost containment. And that's not happening.
Congressman Yarmuth, $1 trillion health care bill that's going to save money. I mean, you know, I got to tell you, some of the emails I get say, you know, I may be dumb, but I'm not stupid. I mean, nobody's going to buy that argument, are they?
Well, I mean, I understand it sounds counterintuitive, but you have right now a situation, and we've tried to talk with the CBO. We say, what if we do nothing? What if we don't reform the system? And everyone agrees we're headed for a disaster. $37 trillion worth of more debt in Medicare alone.
But do you need to spend $1.6 trillion, Congressman? Well,
it's not 1.6. Our plan is actually just slightly over $100 billion a year for 10 years. 1.042
Since when has the government plan done anything but commit a cost overrun?
Well, I don't know. We're working on some of those in the Defense Department.
I've never seen one. I've never seen one that comes in either on budget or under budget.
Well, I mean,
problem is
Medicare operates much more efficiently than the private insurance system does right now, and that's a government-run program.
Well, Medicare operates because it's subsidized by the other plans. This is the problem.
Yeah.
We're going to end up with a plan, not just a public option, but a government-run program that is going to be funded by 8% surtax on people, on businesses, on small businesses. All of that is going to cost a lot more because we won't have those insurance plans
Congressman
anymore.
Yarmuth, I want to bring in the last question to you because you brought it up, the House Ways Committee and their actions. And last week, as you well know, every single Democrat on the Ways and Means Committee voted down an amendment that would prevent illegal aliens from getting government health care. Are you with them? Are you in favor of giving public health care to illegals?
Well, first of all, the law doesn't allow any illegal immigrant to receive benefits under this plan. The amendment, what it did, and this is one of those in-the-weeds things, the amendment basically gave private companies access to Social Security data in order to verify it. That's against the law, and that's why we had to vote it down. It's not that anybody wants to do everything we can.
So you are not in favor of public health care for illegals, correct? You're on record as saying that.
I am not in favor of public funds being used to finance care for illegal immigrants.
Thank you very much, John Yarmuth, Judy Biggert. Thank you very much for being with us. Julie?
All right, Greg. Well, some frightening moments from a deployment ceremony in Washington State. Take a look at this.